Oh, we've got legal aid on here. Wonderful. I love legal aid.
Good morning. How are you?
I'm doing well. Do you guys have
Hi.
any updates to my re or expungement hearing?
Yes, I actually do. I'll send you an email today.
Wonderful.
We're making progress, and I think we're going to be in pretty good shape. So actually, we were just talking about you yesterday. So
Awesome. Hopefully all positive.
all positive. Yeah, I try to come to as many of these meetings as I can. Working statewide, these are a great way for me to get the pulse on what's happening in each of our regions. And this one popped up, and I was excited I could be here. So always
Great.
thanks for having me, and
We're happy to have you.
we'll get you some information.
Awesome. Thank you. Okay, well, we'll go ahead and get started and hopefully some more people jump on. If not, it's okay. We'll make do with who we have, and we love everyone that joins this meeting. Um, Raj Masih has agreed to present this meeting to kind of give us some updates with what's going on in the ODCP world. We love what he does for the guild as well. He's super important to this line of work that we do. So with that, Raj, I'll give the floor to you, and then we'll go from there. Thank you again for your willingness to do this.
Absolutely. Thank you so much, Eric, and thanks for allowing me to talk a little bit. I work as the lead coordinator for the West Virginia state opioid response. And our kind of singular goal is to reduce overdose morbidity and mortality. And we've been making some, good headway in this over the past couple of years with the reduction in overdose fatalities in West Virginia. So one of the things that why what I'm about to share is pertinent to this group, to reentry. We know that people who leave incarceration overdose at rates that are 28% higher than the general population. And this is, as you guys know, a variety of factors. Someone who has, maybe long-term opioid use, who gets incarcerated for 30 days or 60 days in regional jail. Um, a lot of times, the main thing on their mind is as soon as I get out, I'm going to, where can I procure drugs? How can I get high again? Or it is, they get out and they can't find a job, they don't have resources, and they fall back on, I don't want to feel this way. And so they, resort to using drugs again to alleviate the pain of the social determinants of health that they're going through. And so, because of this, we see that large numbers of people leaving incarceration who are in the reentry process do have higher fatality rates than the general opioid use disorder population. And one of the things that, how do we track overdoses? So, EMS, law enforcement, they use an app. It's a phone app called OD Map. This is the overdose mapping application. And when someone EMS responds to an overdose, they basically put into the OD map, male, female, suspected substance, did they give Narcan, how many doses, and sort of where did the overdose happen. So that's the way that the Office of Drug Control Policy kind of uh, gathers this data. We have additional inputs, including from emergency departments, um, where they may do drug testing, and also from the Office of the Chief Medical Examiner for fatalities. So you have multiple data streams, and that's how we keep, from an epidemiologic standpoint, that's how we keep track of overdoses that happen. We can break it down by county, by region, and for us, we track these every single day in real time, overdoses as they happen. And we also, many of you have been involved in this. We also track unreported overdoses that, people self-report, these QR codes that are on Narcan boxes, the cryptids, that people self-report, hey, I reversed an overdose, I didn't call EMS, person never went to the hospital. So we independently track those also. So that's another data set. And one of the things that happened last year we had over 38 overdoses in a very short time period in Kanawha County. And EMS was doing back-to-back runs. And so they were not able to put it into OD map in that time. They drop somebody off, get another call, go pick up someone, drop into the ER. So multiple EMS units on the run. Nobody was putting anything in OD map. And we were just hearing through social media, through different people, hey, there's this, 50 overdoses in Charleston. Other people were saying this is happening in Huntington. Social media is telling us it's happening in Buchanan. So it was like craziness all over the place. And we were trying to get a handle on this and not really, other people were saying, hey, my aunt works in housekeeping at CAMC Charleston. She is saying this, that all these people are coming in with overdoses, but we didn't have any real concrete information. And so we couldn't really deploy boots on the ground, knowing where the regional coordinator should deploy and get out there and distribute naloxone and try and link people to treatment. So that was a gap that showcased a weakness in our reporting system and our response. So Dr. Stephen Lloyd, the director of the Office of Drug Control Policy, created a task force, and I'm on that along with people from Marshall University. And so we came up with a proposal for an overdose incident command structure. The same way if there was a tornado, weather emergency, the same way that we would be able to confirm that this is happening and respond in real time. So I'm going to share screen to discuss what this looks like. Can you guys see my screen? Can y'all see this?
Yes.
Okay, great. So this was the proposal that has come up with, after months of working on this. Like I mentioned, there were 38 overdoses in 16 hours in September of 2025. And coupled with this, not only do we have, one of the highest fatality rates, but overdose clusters, are not being captured through official monitoring systems in real time. We have a fragmented response. So there's, people are siloed, agencies are responding in different ways. And into the mix, we also have new synthetic threats, right? So we have the nitazines, obviously xylazine, you guys know about, medetomidine, which can't be reversed with naloxone, and now the orphines like cyclophorine, which is making its way into West Virginia. So this is kind of the perfect storm for not being able to respond to a massive overdose surge in real time. So the overdose incident command structure, when we first started looking at this, our solution was, well, let's just, surely the 911 centers in all 55 counties have like a central agency that we can partner with to get this information. And it turns out that 911 centers do not have a central agency. They are, in fact, funded, supported individually by the county commissions. So they don't talk to each other and they act very differently. And so when we were trying to, who is the keeper of all secrets? Who knows this? Who would know? So it turns out that there are 5 medical command centers in West Virginia. They're the keepers of all secrets. So what does this look like? So let's say Eric is responding to an overdose. Somebody he knows overdoses. He calls 911. They initiate EMS coming to them. Once EMS makes contact, picks up the patient, before EMS can head to your local ER, they have to call MedCom, their medical command center for their region, and say, hey, this is, EMS Unit 26, we're coming at you with a 30-year-old suspected overdose. These are the vital signs. And then Med Command will then direct you where to go. So for example, if one emergency department is overrun, it'll divert you to the next nearest appropriate emergency department. So those decisions are made by MedCom. So our system was really it's built for these type of overdose surges, to identify clusters as they happen in real time, not days later, to verify the surge is real, and then to alert health emergency community agencies and respond in real time by deploying naloxone outreach teams and treatment resources. So the OICS has kind of two teams working together. So one is the investigative arm, and led by Dr. Todd Davies and Cynthia Pursley from Marshall University School of Medicine. So their job is to determine what was the substance. And so they are sending out rapid drug testing kits to every single emergency department in the state, so they can collect real-time data from ERs and produce these intelligence reports rapidly. They also have a toxicology lab in case there's a brand new, novel, unknown substance. They have a toxicology lab through Marshall University where these can be sent to by overnight and rapidly tested and the new substance identified. The second arm is the response arm. So we've identified a surge. So how does this happen? The West Virginia State Opioid Response Regional Coordinators, who are located in all 6 regions of the state, they can contact MedCom to determine whether a surge is happening or not. If they determine it is, then they can alert state agencies, Office of EMS, Emergency Management, ODCP, deploy naloxone, distribution to the affected area, and try and connect people to treatment and recovery support in real time. So what happens when an overdose surge is detected? So multiple overdoses occur in a short period. Maybe reports are coming in from hospitals or community members. Then the regional coordinator can contact their local MedCom to confirm if the surge is real. If the surge is real, issue an alert. And this alert is sent to, again, ODCP, OEMS, the Marshall Investigative Team, and local emergency management. And then the community teams mobilize, distributing naloxone, coordinating care, getting the word out, connecting people to treatment. And the Marshall University runs toxicology to identify the substance. And these guide public messaging, future response, and prevention strategies across the state. So these are the 5 MedCom centers. So for us, it's the North WVU MedCom at Ruby Memorial Hospital. But these are the 5 MedComs, and they're scattered throughout the state and cover the whole state. So who is part of the overdose incident command structure? The West Virginia Office of Drug Control Policy is basically overall leadership, policy direction, responsible for getting MOUs signed for data sharing between OEMS, MedComs, emergency departments, and the regional coordinators. Obviously, the SOAR regional coordinators, ground level verification, community mobilization and outreach, Marshall University School of Medicine for toxicology, hospital emergency departments for real-time clinical data on overdose patients. If you have an unknown substance, what did the person present with? What were the clinical signs that did they have seizures? Were they foaming at the mouth? Were they unresponsive to multiple doses of naloxone? So the clinical picture of what that looks like, again, is on these cards that Marshall is sending to every ER. And then the Office of Emergency Medical Services to shore up. Maybe we need more units sent from outlying regions to support a surge. And then law enforcement agencies for helping with scene intelligence to identify the substances in circulation. So we kind of have a 12-month rollout plan for how this will work, building the foundation, connect the data, train the teams, launch the live pilot, and then evaluate and improve. So what will this achieve? Faster naloxone deployment means more lives saved, faster identification of new synthetic drugs, full coordinated response within hours, not days, statewide coverage, more people connected to treatment and medications for opioid use disorder and recovery support, and a national model, potentially scalable framework that other states can use. So very excited about this, that basically this framework will fill a huge gap, weakness that got exposed, and, innovative ways in which we can counter this through partnerships and basically build a structure that is robust and can work, in real time when a surge happens. So thank you very much for letting me share that. And if there's any questions, I'm happy to answer. But
Awesome. Thank you so much, Raj. I had a question about overdoses in general. Are they down or have they been on the decline, or is it overdose deaths?
yes, so the main metric that we track is overdose fatalities. So 2024 to 2025, we had a 42% reduction in West Virginia of overdose fatalities. We had the highest reduction in the nation. We were higher than anyone. Uh, in the 12-month period, April to April of 2025 to 2026, we have a 27% reduction in overdose fatalities. So all the stuff that you guys are doing, all of you are involved in this. Things are working. Things are working. The response is good. Lives are being saved. Are overdoses in general dropping? The answer is no. But fatalities are dropping, which is the most important thing.
So do you think the number of people using is still where it's at or even higher and just the joint effort to combat this is better and more effective and
Yes.
okay.
Yeah. Again, I said we track overdoses in real time, every single day. I got 11 alerts on my phone this morning. We had a spike alert from Anne Arundel County yesterday, which is a feeder for our part of West Virginia. We had a spike alert in Columbus, Ohio, which is a feeder for multiple counties on the western part of the state. So we track these in real time. We put out notifications, stakeholders involved in doing outreach. Those of you who know Adrienne Brubaker, she's based in Berkeley County, does amazing, amazing outreach work with teams from East Ridge and other partners in the area, and constantly saturating with test strips and naloxone and linkage to treatment. So a lot of good partners are doing really good work.
Awesome. Another question. These variants coming out where naloxone is not effective for reversals, is there anything in development to combat that or
Sure. So let's say it is a general substance that naloxone doesn't work on. Let's say somebody took 500 Benadryl, they're unconscious, unresponsive, or they drank 3 bottles of liquor, they're unconscious, unresponsive, or they took full bottle of Valium, 10 milligrams, and they're unconscious, unresponsive. So the standard of care for that treatment doesn't change, and as far as the medical aspects of it. So once EMS gets involved, they will, provide, the patient will be intubated, they will be put on a ventilator, they'll receive life support, they'll receive, fluid resuscitation, and ultimately the liver will metabolize that thing and it'll wear off and go away. So basically, the standard of care for an unknown substance hasn't changed. You're still going to get all of these things, advanced cardiac life support. But what we can do in the community has changed. Obviously, medetomidine, which is a veterinary anesthetic drug, in humans, if we were going to do surgery on you, Eric, and we needed to, anesthetize you to put you down to do surgery, one of the things in humans we would use is called etomidate. So the veterinary version of etomidate is medetomidine, which is basically just puts you out. So, it has a half-life, it wears off, and the person can recover from that.
okay. Awesome. Thank you again for the clarification and update. Does anyone else have any other questions for Raj pertaining to what he presented? Well, we certainly thank you again. Since we're only 20 after 10, yes, thank you again. It's awesome stuff. Does anyone else have any other updates they'd like to present from their agency, from their region? Audra, I'm glad you jumped on. It was good to see you yesterday.
Yeah, if I could, real quick, Eric.
Sure,
Um,
yeah, absolutely, Kenny. I didn't even see you on here. I'm glad you're here.
Thanks. So the ACLU and our organization, American Friends Service Committee, are partnering together to put together some screenings around the state. PBS did a special series on um, criminal law reform, incarceration, and we were able to secure funding from the Just Trust to hold screenings of this program around the state. In July, hopefully July 1st, um, one of the screenings is going to be up in Martinsburg, and we really like as many people as possible to come out for the screening. We're getting details of the location, but we're also looking for people that are formerly incarcerated, in recovery, or have any type of criminal justice involvement, whether it's family members incarcerated, or anything like that, to possibly be a part of a panel discussion of the screening afterwards, to get thoughts, possibly answer questions from people that's there at the screening, as well as lead discuss more in-depth discussion about what criminal law reform looks like in our state versus other places. I'm gonna put my contact information in the chat. So if anybody wants to be part of the panel or like more information about the screening that we'll be holding, and once I get location verified, I'll send everybody that information as well.
That would be awesome. Can you tell us a little more about this? I didn't hear anything about that special on PBS on criminal law reform. When did that
Yeah.
air?
They did a special series. It hasn't officially aired yet. They just wrapped the recordings of it, and the Just Trust does a lot of stuff with criminal law reform around the state. Is allowing us and once other partners, because this is like the 250 years the celebration of the country, and the guys the message is, what does the next 250 look like um, for our country, as well as those in the criminal justice system. So they have a program, the Just Trust does, where they're doing screenings of this special before it becomes publicly available, to with funding groups. I haven't even seen the screening yet myself, so I don't I don't know where it was done or anything like that. It's but from people that I've talked to at the Just Trust and other places, they say it's really good. And it's designed to provoke discussion about certain policies and how different states can advance those same policies in their legislature.
Sorry, I was on mute. So the panel you're talking about, does that have to do with the screening of that criminal
Yes.
law reform? Okay.
Yeah. So they'll watch like this screening, and then they'll have a panel discussion afterwards, and discuss it. Maybe have people in the audience ask questions, or even give their own thoughts as to what they think needs to be done in our state.
Awesome. And did you have a date for that or you don't? Don't know
Yeah,
yet.
the date is looking like it's going to be July 1st
July
in
1st. Okay.
Pittsburgh, but we haven't secured the location yet.
Awesome. Much appreciated for that information. Sam, can I put you on the spot to talk about the what we did at the jail on April 22nd? Sam, I think this is our first reentry council meeting. She works here at Potomac Highlands Guild. She's kind of our liaison for the West Virginia Jobs and Hope program. Um, but we had a very, in my eyes, it was a very successful career job employment partnership fair that we did at Potomac Highlands Regional Jail. And they haven't done one of those in years, and it's taken us a while to get through the door. Um, and I thought it was very effective. The feedback we got um, from the ed teacher there was, the inmates loved it. They want us to come back. They learned a lot about resources in the area. So if you want to touch on that, Sam, I'd much appreciate it. If you don't want to, I
Sure.
understand.
So hi, I'm Samantha Kearns. As he said, I am the Jobs and Hope PRSS here at Potomac Highlands Guild. So we did something similar at Eastern Regional about a month and a half ago. It's essentially a job and resource fair. So with that, we try to get potential employers involved as much as possible, but this one at Potomac Highlands really focused on the grabbing the reentry. So often reentry gets, at the wayside. They get lost. They come out, they don't know where to go with the resources, how to get those resources. That's why we lose so many back into addiction. Like Raj said, you have them in there all this time, and I can speak from experience. 9 times out of 10, all you're thinking about is when you get out what you're going to do, and it's not necessarily good. So we're trying to refocus while they're in there, plugging them in with resources that are available to them while essentially they are incarcerated. They can get some of these services lined up, plugged in with a peer, or potential employment lined up when they come out. Jobs and Hope, we do have a list of second chance employers. If not necessarily with employment right away, we can break down barriers. I mean, we can go start at the very bottom, driver's license, helping set up payment plans, getting an education and training to get that career goal, not just a 9 to 5, barely get by job. So what this is designed to do, it's to let the inmates be heard. It's to let them know that, you know, there's so much more for them out there. I mean, we had DMB come in with that to talk about what it does look like to pay off the fines, to get the license back. I mean, all of this stuff is within reach. We had, I believe it was Eastern came out, so they're starting, really branching out with workforce things. They're starting a whole new heavy equipment operators course, which is going to be phenomenal for this area. Now, Jobs and Hope, we partner with Kingwood and the military authority for their heavy equipment operators course. It's a 28-day program. Now, Eastern's kind of condensing that and making it more reachable. We did have adult ed there, so Jobs and Hope is now partnered with adult education. We go hand in hand. And when you hear adult education, you think, oh, GED, I don't need that. That has changed dramatically. They have so many career and industry recognized certifications that come off the jump now, and that is 100% free. So there's no funding needed, no grants needed, nothing like that. Um, I believe we have Pyramid there, which, it gives them a sense of security. God forbid something does happen. We're all human. But I mean, we had so many resources reach together. Like Heather Bergdahl was there. She's the supervisor for the peer recovery here at the Guild. It was just nice to network and see everybody kind of come together to try and capture that re-entry before they fall. Let's not set them up for failure. Let's set them up for success. Let's give them the abundant amount of resources before they come out. It was a great success.
Awesome. Thank you so much, Sam. We hope to do this kind of twice a year, spring, fall, if possible. Just a wonderful team collaboration. Again, we do it for the inmates. A lot of us have been there, and like Sam said, it's the last thing you're thinking about is what to do when you get out. So, kind of helps provide some direction to them. So if anyone is interested in the future of getting in on that, it's a wonderful opportunity. I think legal aid would be awesome to have you guys there.
Yeah, I would love to. I actually, my sister got married 2 days after this one, or I would have been at this one. But we're hoping to come to the next one. I've taken my paralegal. We've gone to 3 facilities since she started, and I've gone to a few more. We're going to one next week. It's her favorite thing because she gets to talk to a lot of people and learn about more resources that we don't even see every day at work. So we really enjoy getting to participate and definitely count us in for the fall. We want to
Awesome.
we want to make it to the next one.
We will make sure of it. In fact, we had one inmate, and I had to look it up because I didn't know, but she wanted to take the paralegal classes that you can get certified while incarcerated. And I can't remember the
And
name of that program.
in West Virginia, you don't even have to have a formal certification to act as a paralegal under supervision of an attorney. So it's a great job for people to get some training on and learn about because justice impacted people, they know how to speak to clients, they know how to kind of work through this already through this work. So I highly recommend it if you have clients or participants looking for a field. We always need really good paralegals. They do really hard work. So that is fantastic.
Awesome. Well, we look forward to having you at the next one. I'll make sure we get an invite your way. Awesome. Does anyone else have any other updates with their program agency?
I
Anything?
do. I do.
Awesome.
Audrey, it was great to see you and Keely yesterday, Eric. I first wanted to say that. And Raj, it's great to see you on here as well. So I'm in Maryland. Things are a little different. I do a business of living class at the jail. Business of living, for those of you who aren't familiar, just a quick rundown because there's a lot to it. It was created by prisoners. So I get to go into the jails in Maryland and I start working with the girls on a reentry plan before they ever step foot outside that jail. They have also promoted me to state care coordinator. So I get to stay with them. That's the beauty of that. They get my card while they're in there. And once they are released from incarceration, I can now work with them on birth certificates, jobs. Some of my girls even got college credits. And it helps because Audra went to college at 42. So when they're sitting there, 35, Audra, no, it's not too late. I didn't graduate till I was 50 and you can do it too. Just take your time so you don't overwhelm yourself. But I think it's always important that what we're teaching them comes from people who've been there. So the fact that this was created by prisoners is just amazing. There's a bullseye in the middle of the book. They are the bullseye. And then we start goals. So I do motivational interviewing when I meet with these groups and I get their brains going. We do some fun stuff in there too, because Audra's been to jail as well. And, there's something in it for everybody. I want to make it interesting for them as well. They wouldn't let me bring, so we let the girls color. They wouldn't let me bring the colored pencils, and that even kind of worked out. So one girl has a whole bunch of them, and she's sharing with everyone else. So to watch that happen in a incarceration setting is even a big deal too. So, but yeah, there's lots of help we can give people out here if we just stay kind and compassionate. I also heard Raj speaking about substances. So something we have in Maryland that you guys don't have is an anonymous needle exchange. We can give people clean things. We have two peers who also test those needles. I was looking on our board last week because the participant just gets a number. That way there's no, identifying information. And and I was looking at our board one day and there was 15 different substances in one needle. So yeah, I mean, the cartel's just getting worse and worse and worse, with additives and synthetics and mixing all different types of things together. So that was very eye-opening for me as well. But I just want to thank all of you on here for everything that you do. We all work really hard to help these people. So thank all of you.
Thank you so much, Audra. And shout out for the Life Recovery Bibles. Audra and Jim Murray dropped off another dozen Life Recovery Bibles, which is awesome. So it seems like we keep getting, their next batch, and we'll take them to the jail, and then we'll get another batch, take them to the jail, and that's apparently the book. If you're incarcerated, that's what the inmates want is the Life Recovery Bible. So we love it. I wish we had the grant funding to continue to get those, but for some odd reason we cannot. No, we no longer can get those. Um, but anywho, Keely, nice of you to join us. Do you have anything you want to add?
Oh, thanks for having me. I had a client. Well, I could have missed half of it here, so I don't know what you were talking about. I heard recovery Bibles.
You missed all of
Um,
it. Okay,
yeah, no, I don't know. I hope everybody's doing well today, though.
for sure.
Yeah, I don't really have anything to add. Did you tell them about us going into the jail and stuff, all
I
that?
did. I put Miss Kern on
Okay.
the spot who talked all about
Okay.
it. She did.
Okay.
She did
Well,
wonderful. Proud of her.
I'm good. Nice job, Sam. I'm sure you guys probably said everything that needs to be said then.
Thanks, Keely.
You're welcome.
If anybody would like to present or would like or have any ideas of who would be a good presenter to ask, please let me know. I think this was the last one we had scheduled, so I'd like to get June and on possible, if possible, scheduled sooner than later. So shoot some ideas my way if you have anyone you think would be good for this. Legal age, you're always welcome to present
I've
if you
I've
want.
done an expungement training at two of the councils so far this year, I think. So we're always happy to if that's something that the group is interested in. I know every region has different interests. So if there's another topic that's more exciting, we can always pivot. But let me know. That's fine with me. Whenever you need something, we're always happy.
Okay. Well, just a heads up, this is the first Thursday of every month at 10 a.m. So if any of those dates, any of these first Thursdays work for you, let me know and I'll schedule you in.
All right, we'll shoot you an email then.
Okay.
And quick update just for everyone here. I am offering virtual expungement clinics for potential clients of legal aid every month, twice a month. I do one in the mornings and one in the evenings so that it's open for different work schedules. Um, I'm the Jobs and Hope attorney with legal aid, so a lot of it is tailored more for my Jobs and Hope clients, but it's open for everyone. So if you do have someone who wants to learn more, just general information about the process of going through expungement, they're an hour, very easy to log on through Teams, and always happy to share the links for those. Just let me know. My email is in the chat. Um, and they're free and easy to join. So that's my only update.
Thank you for that. Yes, Miss Matthias.
Hello. So, this isn't specifically an Aetna thing, but West Virginia women work in Morgantown recently has gotten, and I can connect you with them, Eric, funding, funding, funding for a program where they can work with folk in recovery, male or female. This is kind of an extension of their regular 12-week program that is women focused. And so what they do is come to you and they can do hands-on like they can bring a forklift and train people in how to run and operate a forklift and certify them, this sort of stuff, carpentry type things. The agency West Virginia Women work with a lot of unions in the state, so they can get these folks into jobs that are paying well above what we all make, which is incredible, right? And do it quickly. Um, so I can connect you with them. That may be something that Potomac Highland Guild wants to do, or have them present at the reentry meetings.
Yeah, that would be amazing.
Well,
Do
thank
you
you.
know any of the prerequisite requirements? Like, is this focused on people in recovery, or is it people with past charges eligible, felony convictions? Do you know
I
anything?
think the way the grant is written is just folks in recovery. It's a 1 year grant. So there's definitely room probably if you say, hey, I have X amount of people that are in recovery that are in reentry that would want to do this, maybe that expands how they rate future grants.
Yeah, absolutely. Yeah, if you could somehow forward me on some contact information, I will
Absolutely.
definitely
Put
see
your
what that's all about.
put your email in the chat, please, and I will do that now.
Sam, that definitely sounds like something Jobs and Hope could kind of show an interest in. I just, to me, I don't know. It sounds very, very promising. I'd like to know more about it.
Absolutely. I'm going to drop my email in the chat as well.
Awesome. Okay, wonderful. Well, this has been a great meeting. I've learned a lot. Thank you again, Raj. I really appreciate it. I know I've probably asked you to do this like 3 times, but you've always come through. And this is unfortunately a field where there's going to continue to be updates. Sometimes they're not all positive, but it seems like for every negative that comes up, when things seem to get worse, they can also get better. So I think that's why it's important to continue to update people on what's going on real time. So. All right, well, I guess we will see everyone. I don't know off the top of my head, whatever the first Thursday is, June something at 10 a.m. So we'll see everyone there hopefully, and I will work on getting someone scheduled to present. So thank you all again. I hope you all have a good rest of your day.